what happens when you fall asleep, when you're laying there before you go to sleep, your muscles are still controlling your shoulder. Then you fall asleep and the muscles stop working, and all of a sudden you're sort of hanging on your shoulder. And we talked about postural issues before with forward shoulders. And the other thing with shoulders, if it's right next to your side, you're actually compressing the blood flow a little bit to the shoulder. So a couple of things that we recommend is rolling up a towel, putting a pillow under the armpit, and having a little support behind if you're laying on your back, so the shoulder doesn't kind of fall back on you, just so it's a little bit more controlled and it's a little bit more open, and that typically helps people sleep a little bit better.
If you can't sleep on your back and you just say, I can't do that, it's just impossible, then sleeping on the unaffected side with a pillow in front of you so that the arm doesn't fall forward in front of you as you're laying on that side, but rather it's supported a little bit out to the side, which aligns the shoulder joint a little bit more where it should be. And again, keeps it from that forward rotation or falling forward, which puts a lot of strain on the posterior part of the cuff. If you absolutely want to sleep on the painful side, some suggestions are you can take large pillows and put them between your hips and your rib cage so that you're kind of lifting yourself up a little bit and you're unweighting that joint just a little bit. And that may improve your pain. But if you do that, then you also need to increase the size of the head pillow, because you need to raise that up so that your head is not off to one side. I think in all of these positions, you need to make sure that you've got your neck in a nice neutral position, which means it's not cocked back looking at this way back at the ceiling in the headboard, but it's not pushed too far forward because you've been looking at your Kindle before you fell asleep. For all of those, you really need to have your neck as neutral as possible, because those muscles really affect the shoulder. And so it's all connected, and making sure that you're in good alignment when you sleep. But if it's the lower back, I would say sleeping on your back with the pillows under your arm, like we discussed before, to put your shoulders in better position, and then possibly something under your knees in order to kind of keep your hips flexed a little bit, which may help you keep your low back a little bit more on the mattress. If it is your neck, then again, we want to make sure that you've got a good solid pillow under your neck and that your neck is in as neutral a position as possible. And sometimes that may be that you need to put towel rolls on either side of your head so that you don't end up getting off to the side or imbalanced somehow when you're sleeping, which ends up getting you sore when you wake up in the morning. So that would be my best advice.